Thank you so much for joining today. I'm Alexandra, the brand educator here at MDPen, and we are quickly moving into this acne series for the month. We're talking a lot about scarring. We're also talking about surgical scars, and hopefully you were able to see my LinkedIn video. Yeah, I'm breaking down the different types of atrophic acne scarring in that series. So that will be every Wednesday on LinkedIn at noon. So for today's video, I wanted to talk about what age do acne scars develop and when should you start treating them. And even though I knew the answer to this question, I did want to do some actual research for you guys. I did find an amazing article from the Journal of Cutaneous and Aesthetic Surgery. This was from the National Library of Medicine. The link will be shared in the comments if you do want to check out the journal. This was published in 2020. So it was pretty interesting. So in general, with acne vulgaris, it does tend to happen earlier in females, so sometimes around 14 to 15. However, you can see sebaceous glands start changing in the skin as early as 10 to 12 years old. And in those cases where you just start seeing changes in sebaceous glands or oiliness or like congestion at the nose, I recommend getting not using anything harsh, but even something like a creamy glycolic cleanser. Children that young don't need, any type of like heavy duty treatment. They're not going to have severe acne, but moderate to severe acne vulgaris can occur at 14 to 15 for females. Typically, with boys, it's going to be around 15 to 16 years old. And in the study that I did read, this was a test done in a hospital with 100 patients. I believe the average age was around 26, median age. They did have more males in the study than females. However, males tend to experience more of that severe type of scarring acne. We do know that women, as many as like I've heard it anywhere from around 35% to 40, can have some form of acne till the day they die, like hormonal breakouts. But in this case, we're talking about that moderate to severe scarring type acne. So basically in the study, they did find that in boys that the acne lasted sometimes for around 99 months. It could last longer. Most of the severe to moderate acne had resolved as far as continued breakouts by age 25. What they did find as well was that ice pick scarring was by far the most common type, followed by rolling scars, box scars, and then keloid scarring, which was also more common in the boys or the men. So another thing that's really big is the average time that people waited to treat their scarring. Women, the girls that were women, did end up, treating their scarring sooner. Whereas with the boys who were now men, waited a more prolonged period to treat their scarring. And in cases of acne scarring, the more preventative work you can do early on. So when the acne is happening, the better. It is an inflammatory disease that is causing this scarring. I do see questions coming in. Here's that article for you guys. It is in the comments. It was, very interesting, especially if you are interested in knowing which types of scarring are more common and things like this. I see questions here already. Thank you guys so much. Okay, what skincare products do you recommend for active and acne scars? So in the case of active, okay, so this is a loaded question. In the case of active, with this video, I'm talking about moderate to severe scarring. So these are patients that need to be under the treatment of a physician, ideally probably under a dermatologist. I will say with MDPen, our skincare is amazing as far as being able to still hydrate acne-prone skin or skin that is acneic without causing additional acne. And in cases of moderate to severe acne. A lot of times the prescriptions that are topicals can be, very drying. So I would definitely recommend having our hydrate cleanser on hand. And this goes for Accutane patients as well. These are going to be safe products during the time that they are using Accutane. Definitely our hydrating cleanser, our pure hyaluronic acid. This only has 5 ingredients. And the HA in here is not going to make acne worse. Sulfate free, fragrance free, dye free. This is going to be an excellent moisturizer, especially in young skin, kids, teenagers. It's going to be ideal. Now, acne scars. Human derived growth factor gel all the way. You can either buy it in the 1 ounce size or the 3.4 ounce size. This is something you definitely want to have for your acne scarring. You want to have it for repairing that compromised skin barrier. Ask your dermatologist who's treating you with Accutane if you can, sleep with this on your face at night. This is also going to help. You do get severely dry during that treatment. I do want to share with you guys a shopping code. It's going to be acne06. You can use this on our website, whether you're shopping retail or professional, and you can buy anything, but these are the 3 products I really want to, drive home when it comes to talking about being able to hydrate, that really moderate or severe acne without causing additional breakouts. What is the ideal age to start with microneedling for scarring treatment? Great question. So this is going to be always at the discretion of your physician. If you are an esthetician, make sure you're always getting the okay. Make sure the physician is diagnosing the patient before you treat them. This is the rule in most states. Now, as far as Accutane, this again will be up to the physician, but typically they need to be off Accutane for a year before you can treat the scarring. I have seen some dermatologists give the okay at the 6-month mark, but always do look into that. 1 year is a good general rule. You do want to wait until the breakouts have stopped, subsided. You don't want to treat over pustular acne with microneedling. You don't want to treat over papular acne, and you definitely don't want to treat over nodular or cystic acne, which is often what causes boxcar and rolling scars. So you want to have this resolved. If their breakouts are under control, resolved, they've done oral antibiotics, they've completed Accutane if that's happened, or that it's been controlled with topicals, by all means, you can treat a 15 or 16-year-old with microneedling, with the parental consent and the okay of your medical director or physician. This can be done, but you do want to make sure that it's, again, in a state of control, and you're not treating over. I do want to share those links with you guys. This will take you straight to the growth factor gel link. It is going to come in those 2 sizes for retail. It's got the 1 ounce size and the 3.4 ounce size. If you're a professional, we do have the big 16-ounce pump, which is the best bargain you can get, and have that right there in your exam room. This is the link for the hyaluronic acid. Again, there's a 1 ounce size and then a back bar professional size, and the cleanser as well. You can definitely check those out. These are 3 wonderful hydrating products from MDPen that are not going to aggravate your acne. They're going to soothe. You've got marigold, chamomile, green tea in the cleanser, HA, snow mushroom, and those wonderful growth factors. And be sure to use that shopping code. Oh, great question from Rachel. What is an ideal product with MDPen in addition to the cleanser for teens who may not be willing to stick to a full regimen? Yeah, so this is a great point to drive home. Oftentimes with teenagers, especially with boys, it really takes a while for them to, care enough to be really compliant with skincare. But you would be surprised, especially when that moderate to severe acne is happening. That's when it's like, okay, this is a problem. I do want to treat this. There's definitely things they can do. First thing and foremost, yes, get them cleansing morning and night. This is so important. If anything, that nighttime cleanse is like vital. They've got to get all of the daily dirt, debris, oil, everything off of their skin. One thing they can do is take the copper HA mist with them. This is helpful, for PE recess. Ideally, they can cleanse, off their skin. If you have a teenager that's involved in sports or something where they're like wearing a helmet or a cap. This is nice, for under the forehead area. You'll see major breakouts in the hairline and the forehead. So this can be really helpful. It's easy to use. Kids really seem to like mist and foams and things like this. So this is something you can add as far as people that are severely dried out from oral acne medications. They will need something a little bit more like the serum or the gel. But this is very nice, very soothing. It's going to have the copper, zinc, and manganese. The copper is going to have the antimicrobial properties. The zinc is going to help control the oil and sebum production. And then manganese is going to help with the elastin. So this is another thing that can be used. Another thing I definitely want to drive home for this topic, especially maybe for someone who's treating scarring in their 20s, 30s, 40s, 50s. If you have the budget and it's an option, or if you want to save for it, look into the MDPen radio frequency microneedling. Now, yes, this will, it can cost about 3 times as much as regular microneedling, but one treatment with this is going to be equivalent to 2 to 3 regular microneedling treatments. And you're going to get that tightening result at the same time. I am talking about that middle hand piece there. And when it comes to rolling scars, boxcar scarring, ice pick scarring, if you are seeing a provider that happens to have both the intensive in the middle, the RF microneedling, and the FSR, fractional skin resurfacing on the left, this is a wonderful, beautiful dual combination treatment that's really going to help skin texture, post-inflammatory hyperpigmentation, the scarring itself. It's going to rebuild that collagen. And then, of course, yes, there's MDPen. There's traditional microneedling as well to help with scarring. And you do want to do a series. The series can be obviously less in numbers than traditional microneedling because you are getting those extra results. With acne scarring, just like anything else, you do want to keep up with touch-ups, whether it's seasonal, twice a year, annually, whatever your provider's recommending. You do want to stay on top of things. As we age and lose collagen, the scarring can become more apparent if it has been untreated, especially in like the cheek area. One thing I did want to touch on with the study as well, facial acne scarring was, far more common, but I believe around 3 to 5% of people in the study did have chest and back acne. So definitely don't forget about that. And if you are a provider who's doing a consultation with someone who has scarring, always ask about their chest and back. They may forget or they may be self-conscious. So definitely, find out about that if you can. See another question coming in. What is the downtime with RF? Great question. So with radio frequency by itself, which I have not talked about at all in this video, there is no downtime. Now, I'm sure you're talking about radio frequency microneedling, which again is that middle handpiece there. You can actually see the needles there on the cartridge, the gold plated, gold non-insulated needles there. And with this treatment, it's going to depend. It's going to depend on your skin, the thickness, the depth that they were at. Depending on which device they had, they could be going up to a 3.5, up to even a 5 millimeter depth. It just depends. But in most cases, you're going to look pretty good 2 days out. You will have, in some cases, small little tiny grid marks on your face if someone was to be up close to you, but it's nothing that should keep you away from doing things. And within 48 hours, you could use like a tinted mineral makeup or something like that to cover. I will say in like 5 days, you can pretty much rely on your skin looking 80% normal. For sure, after a week, you should be looking normal. Typically, the more fair you are, the faster you can recover. If you're a Fitzpatrick 5 to 6, you may want to allow 5 to 7 days if there's something you're planning for, or if you want you know, if you have a job like being a realtor or something like that. But there's really not a lot of jobs now where we're really close to people and really self-conscious. But hopefully that gives you a good idea about is the downtime. It's really not bad. If you were to get red puffy or something like that, that's something that would definitely subside in those first 2 days. But all of those little grid marks or anything like that, those are gone in 5 to 7 days for sure. And by using the MDPen Aftercare, and if your provider did use PRP or something like that, all of these elements can definitely help speed that up for sure. Thank you guys so much for your participation in today's video. I think it's a really interesting topic. I always love treating acne, treating scarring, treating people throughout their process. I can't drive home enough how important it is to treat this early on. But of course, it's always at the parental consent. And when you are consulting with a child and their parent, you know, always talk to the parent directly, let them know the severity, let them know, you know, the scarring may not get better. In cases of nodular and cystic acne, this can be oftentimes genetic. In fact, with the study of 100 people in the article, they found that, and I'm sure this was perhaps just through asking them directly, did your parents have acne? But 48% of them had this genetic component to their acne. So it is a real thing. So, you know, parents do want to keep that in mind. If they have horrible, severe scarring, you know, their child very well could as well if they don't treat it early on. And as I always say to estheticians, you know, don't assume you can treat something that you don't have the means for, that's not in your realm. A lot of these people with acne vulgaris 4 to 5, moderate to severe acne, they need help beyond you. Estheticians are amazing. I'm one of them, but you know, you've got to get them that extra help, especially when it comes to scarring. So thank you guys so much. I hope the shopping code is helpful. Again, stay tuned for that LinkedIn series if you can make it, Wednesdays at noon Eastern time, breaking down the different types of atrophic acne scars. And thank you. Bye.